Would you like free audiobooks? Click the link in the description. Question 1. A 55-year-old patient with a 10-year history of rheumatoid arthritis, RA, presents to the clinic complaining of increasing joint stiffness and pain, especially in the mornings. Which of the following medications would the nurse anticipate to be prescribed to manage the patient's symptoms effectively? A. Acetaminophen. B. Ibuprofen. C. Methotrexate. D. Prednisone. Correct answer. C. Methotrexate. Rationale: methotrexate is a disease-modifying anti-rheumatic drug, DMARD, that is often the first line of treatment for RA. It helps slow down the disease's progression and decreases joint damage and disability. NSAIDs like ibuprofen and steroids like prednisone can be used for symptom management but do not alter the disease course. Acetaminophen is not anti-inflammatory and is less effective in RA. Question 2. A nurse is teaching a patient with rheumatoid arthritis about self-management strategies. Which statement by the patient indicates a need for further education? A. I will perform gentle exercises to strengthen my muscles around the joints. B. I should keep my joints in the same position to reduce pain. C. I can use heat and cold therapy to manage joint pain. D. It's important to take my medications as prescribed to control the inflammation. Correct answer. B. I should keep my joints in the same position to reduce pain. Rationale: keeping joints in the same position can lead to stiffness and decreased mobility. It's important for RA patients to perform regular, gentle exercises to maintain joint flexibility and muscle strength. The other statements indicate a good understanding of RA self-management. Question 3. Which of the following laboratory tests would the nurse expect to be ordered to help diagnose rheumatoid arthritis? A. Complete blood count, CBC. B. Rheumatoid factor, RF. C. Erythrocyte sedimentation rate, ESR. D. All of the above. Correct answer, D. All of the above. Rationale: all listed tests can be useful in diagnosing RA. The RF test helps identify the presence of rheumatoid factor antibodies, which are present in about 80% of RA cases. ESR and CBC can indicate inflammation and the body's response to it, which are common in RA. Question 4. A patient with RA is prescribed corticosteroids for a flare-up. The nurse knows to monitor for which of the following side effects? A. Hypoglycemia. B. Weight loss. C. Osteoporosis. D. Hypotension. Correct answer. C. Osteoporosis. Rationale: long-term use of corticosteroids can lead to osteoporosis, a condition that weakens bones and makes them more susceptible to fractures. Corticosteroids can also cause hyperglycemia, not hypoglycemia, weight gain, not loss, and hypertension, not hypotension. Question 5. A nurse is planning care for a patient with rheumatoid arthritis who has been experiencing fatigue. Which of the following interventions should be included in the patient's care plan? A. Schedule activities in the morning when the patient is less likely to be fatigued. B. Encourage the patient to avoid naps during the day to ensure better sleep at night. C. Recommend high-intensity exercises to boost energy levels. D. Arrange for occupational therapy consultation to assist with energy-conserving techniques. Correct answer: D. Arrange for occupational therapy consultation to assist with energy-conserving techniques. Rationale: occupational therapy can provide strategies for conserving energy and joint protection techniques, which are crucial for patients with RA to manage fatigue and maintain independence. Scheduling activities in the morning might not always be practical due to morning stiffness and pain. Avoiding naps can be counterproductive for someone with chronic fatigue, and high-intensity exercises may exacerbate symptoms. Question 6. A patient with rheumatoid arthritis reports difficulty with performing daily tasks due to joint pain. Which of the following is the most appropriate nursing intervention? A. Suggest the patient limit physical activity to reduce pain. B. Recommend the use of adaptive devices to aid in performing tasks. C. Advise the patient to increase the dosage of NSAIDs. D. Encourage the patient to perform strenuous exercises to improve joint function. Correct answer, B. Recommend the use of adaptive devices to aid in performing tasks. Rationale: adaptive devices can significantly aid in performing daily tasks by reducing the strain on painful joints and increasing independence and quality of life for patients with RA. Limiting physical activity can lead to muscle weakness and joint stiffness. Increasing NSAID dosage without a healthcare provider's guidance can result in harmful side effects. Strenuous exercises may exacerbate joint damage and pain, whereas gentle, low-impact exercises are recommended. Question 7. Which of the following patient statements indicates an understanding of the management of rheumatoid arthritis? A. I will only take my medication when I have severe pain. B. It's best for me to stay in bed during flare-ups. C. I will follow a balanced diet and keep my appointments with the rheumatologist. D. Applying heat for long periods is the best way to reduce my joint swelling. Correct answer, C. I will follow a balanced diet and keep my appointments with the rheumatologist. Rationale: managing RA involves more than just symptom control, it requires ongoing monitoring and treatment adjustments by a healthcare professional, maintaining a healthy lifestyle, and following recommended treatment plans, including medication adherence, even when symptoms are not severe. Prolonged bed rest during flare-ups and only taking medication for severe pain can lead to worsening of the condition. Applying heat can help with muscle stiffness, but should be used carefully, especially with swelling, where cold therapy might be more appropriate. Question 8. A nurse is caring for a patient with rheumatoid arthritis who is experiencing a severe flare-up. Which nursing action is most appropriate to include in the patient's care plan? A. Encourage the patient to perform vigorous joint exercises to maintain mobility. B. Apply cold packs to swollen joints for 20 minutes each session. C. Advise the patient to restrict all physical activities until the flare-up subsides. D. Increase the frequency of NSAID administration without consulting a physician. Correct answer, B. Apply cold packs to swollen joints for 20 minutes each session. Rationale: cold therapy can help reduce inflammation and numb the area to decrease pain during a flare-up. While maintaining mobility is important, vigorous exercises are not recommended during severe flare-ups due to the risk of further joint damage. Restricting all physical activities can lead to stiffness and weakness. Adjustments to medication regimens should always be made under the guidance of a healthcare provider. Question 9. A nurse is educating a patient with rheumatoid arthritis about the importance of smoking cessation. Which of the following best explains why smoking is particularly harmful for patients with RA? A. Smoking can decrease the effectiveness of RA medications. B. Smoking can increase the risk of developing infections due to RA medications. C. Smoking has been shown to exacerbate the symptoms of RA. D. All of the above. Correct answer, D. All of the above. Rationale: smoking can decrease the effectiveness of RA medications, increase the risk of infections, especially important as many RA medications suppress the immune system, and has been linked to worse RA symptoms and progression. Educating patients about the benefits of smoking cessation is crucial in the management of RA. Question 10. Which of the following dietary recommendations is most appropriate for a patient with rheumatoid arthritis? A. High protein, low carbohydrate diet. B. High fat, low fiber diet. C. Anti-inflammatory diet rich in omega-3 fatty acids. D. High sugar, high sodium diet. Correct answer, C. Anti-inflammatory diet rich in omega-3 fatty acids. Rationale: an anti-inflammatory diet, which includes foods rich in omega-3 fatty acids such as fish, nuts, and seeds, can help reduce the inflammation associated with RA and improve symptoms. High fat, low fiber, and high sugar, high sodium diets can contribute to poor health outcomes and are not recommended. Question 11. A patient with rheumatoid arthritis is experiencing dry eyes and mouth. The nurse recognizes these symptoms as indicative of which associated condition? A. Sjogren's syndrome. B. Osteoarthritis. C. Fibromyalgia. D. Ankylosing spondylitis. Correct answer, A. Sjogren's syndrome. Rationale: Sjogren's syndrome is an autoimmune disorder commonly associated with rheumatoid arthritis that affects the body's moisture-producing glands, leading to dry eyes and mouth among other symptoms. It's important for nurses to recognize these symptoms and facilitate appropriate referrals and management strategies. Question 12. A patient with rheumatoid arthritis mentions using herbal supplements to help manage their condition. What is the nurse's best response? A. Herbal supplements are not effective for RA and should be avoided. B. It's important to discuss all supplements with your healthcare provider to ensure they don't interact with your medications. C. You should only use prescribed medications for RA treatment, not supplements. D. As long as the supplement is natural, it's safe to use with your RA medications. Correct answer, B. It's important to discuss all supplements with your healthcare provider to ensure they don't interact with your medications. Rationale: herbal supplements can interact with conventional medications, potentially altering their effectiveness or leading to adverse effects. It's crucial for patients to inform healthcare providers about all supplements they are taking to manage their condition safely. While herbal supplements may offer benefits, they should complement, not replace, the treatment plan prescribed by a healthcare provider. Question 13. During a home health visit, a nurse notices that a patient with rheumatoid arthritis has difficulty opening jars due to hand joint stiffness. Which of the following is the most appropriate intervention? A. Suggest the patient avoid cooking to prevent joint strain. B. Recommend using adaptive devices designed for people with limited hand function. C. Advise the patient to apply heat to the hands for 30 minutes before cooking. D. Encourage the patient to perform hand strengthening exercises immediately before cooking. Correct answer, B. Recommend using adaptive devices designed for people with limited hand function. Rationale: adaptive devices, such as jar openers for individuals with reduced grip strength, can help patients with RA maintain independence in daily activities while minimizing joint strain. While heat therapy and hand exercises can improve flexibility and strength, they are part of a broader management strategy and not immediate solutions for specific tasks like opening jars. Avoiding activities like cooking can lead to decreased independence and quality of life. Question 14. A nurse is developing a teaching plan for a patient newly diagnosed with rheumatoid arthritis. Which topic should be prioritized? A. The importance of maintaining a sedentary lifestyle to protect the joints. B. Ways to modify activities of daily living to reduce joint stress. C. The benefits of consuming a high-calorie diet. D. Strategies for avoiding all forms of physical therapy. Correct answer: B. Ways to modify activities of daily living to reduce joint stress. Rationale: teaching patients how to modify activities of daily living to minimize joint stress is essential for managing RA. This includes using adaptive devices, learning joint protection techniques, and pacing activities to prevent fatigue. A sedentary lifestyle, avoiding physical therapy, and consuming a high-calorie diet without consideration of nutritional value are not recommended for patients with RA. Question 15. A patient with rheumatoid arthritis expresses concern about the risk of infection due to immunosuppressive therapy. What is the nurse's best response? A. You should avoid all social interactions to prevent infections. B. It's important to practice good hygiene and stay up to date with vaccinations. C. Immunosuppressive therapy does not increase your risk of infection. D. You should stop the therapy if you are concerned about infections. Correct answer: B. It's important to practice good hygiene and stay up to date with vaccinations. Rationale: patients on immunosuppressive therapy are at an increased risk for infections. Educating them about practicing good hygiene and the importance of vaccinations can help reduce this risk. Avoiding all social interactions is not necessary with proper precautions. Stopping therapy without a healthcare provider's advice can lead to worsening of RA symptoms. Question 16. Which of the following symptoms should a nurse instruct a patient with rheumatoid arthritis to report immediately due to its association with medication side effects? A. Increased joint stiffness in the morning. B. Yellowing of the skin or eyes. C. Occasional mild nausea. D. Muscle soreness after exercise. Correct answer. B. Yellowing of the skin or eyes. Rationale: yellowing of the skin or eyes, jaundice, can indicate liver damage, a potential side effect of certain RA medications, including methotrexate. It's crucial for patients to report this symptom immediately for evaluation and potential adjustment of their medication regimen. The other symptoms listed can be typical of RA or mild, expected side effects of treatment. Question 17. A patient with rheumatoid arthritis is being educated on the effects of nonsteroidal anti-inflammatory drugs, NSAIDs. Which of the following should the nurse include as a potential side effect? A. Hypertension. B. Hypoglycemia. C. Decreased risk of myocardial infarction. D. Increased bone density. Correct answer. A. Hypertension. Rationale: NSAIDs can lead to fluid retention and increased blood pressure, hypertension. They do not cause hypoglycemia, decrease the risk of myocardial infarction, they can actually increase cardiovascular risk with long-term use, or increase bone density. Patients should be monitored for changes in blood pressure and cardiovascular symptoms while using NSAIDs. Question 18. A nurse is caring for a patient with severe rheumatoid arthritis who has started biologic therapy. Which of the following is essential to monitor due to the medication's mechanism of action? A. Blood glucose levels. B. Signs of infection. C. Urinary output. D. Serum cholesterol levels. Correct answer. B. Signs of infection. Rationale: biologic agents used in the treatment of RA work by targeting specific components of the immune system, which can increase the risk of infections. It is essential to monitor patients for signs of infection, including fever, chills, or other symptoms. Blood glucose, urinary output, and cholesterol levels are not directly affected by biologic agents used in RA. Question 19. A patient with rheumatoid arthritis is concerned about the risk of osteoporosis related to their disease. What lifestyle modification should the nurse recommend? A. Limiting weight-bearing exercises to reduce joint stress. B. Increasing calcium and vitamin D intake. C. Avoiding exposure to sunlight to reduce skin cancer risk. D. Consuming a low-protein diet to decrease bone loss. Correct answer. B. Increasing calcium and vitamin D intake. Rationale: patients with RA are at increased risk for osteoporosis, partly due to the chronic inflammation and possibly due to corticosteroid use. Increasing calcium and vitamin D intake can help maintain bone density. Weight-bearing exercises, contrary to limiting them, are recommended to strengthen bones. Sunlight exposure should be balanced with skin cancer risk, but it is essential for vitamin D synthesis. A balanced diet, including adequate protein, is important for bone health. Question 20. What is the primary goal of treatment for a patient with rheumatoid arthritis? A. To cure the disease. B. To manage symptoms and prevent joint damage. C. To avoid the use of medications. D. To increase physical activity to the highest possible level. Correct answer. B. To manage symptoms and prevent joint damage. Rationale: the primary goal of RA treatment is to manage symptoms such as pain and inflammation and to prevent or slow down joint damage and disability. There is currently no cure for RA, so treatment focuses on improving quality of life and maintaining function. While increasing physical activity is encouraged, it must be balanced with the patient's capabilities and disease state. Avoiding medications is not a goal, as appropriate pharmacological treatment is essential for managing the disease. Question 21. A patient with rheumatoid arthritis reports experiencing frequent episodes of depression. Which of the following actions should the nurse prioritize? A. Advise the patient to focus more on physical activities to distract from depressive thoughts. B. Recommend over-the-counter mood stabilizers to manage depressive symptoms. C. Facilitate a referral to a mental health professional for comprehensive evaluation and support. D. Suggest increasing the dosage of RA medications to alleviate the depression linked to RA pain. Correct answer. C. Facilitate a referral to a mental health professional for comprehensive evaluation and support. Rationale: depression is common among patients with chronic diseases like RA, often due to the chronic pain and the impact of the disease on life quality. The most appropriate action is to facilitate access to a mental health professional who can evaluate and provide specialized care for depression. Physical activity can help manage mild symptoms of depression but is not a standalone solution. Over-the-counter mood stabilizers are not recommended without a healthcare provider's advice, and adjusting RA medication dosages without addressing the underlying depression is not appropriate. Question 22. A nurse is providing education on joint protection techniques to a patient with rheumatoid arthritis. Which of the following strategies should be included? A. Use smaller joints for tasks to protect larger joints from strain. B. Maintain joints in flexed positions to prevent stiffness. C. Carry heavy objects close to the body using both hands. D. Avoid the use of splints to prevent dependence on support devices. Correct answer: C. Carry heavy objects close to the body using both hands. Rationale: carrying heavy objects close to the body using both hands distributes the weight more evenly and reduces strain on any single joint. It is a fundamental joint protection technique. Contrarily, using smaller joints for tasks that require significant force can lead to overuse injuries. Maintaining joints in flexed positions for extended periods can contribute to stiffness and deformities. While splint use should be monitored to prevent muscle weakness, they are beneficial for stabilizing joints and reducing pain, not something to be avoided entirely. Question 23. A patient with rheumatoid arthritis is being initiated on a biologic agent. The nurse knows to educate the patient about the importance of monitoring for which of the following as a potential serious side effect. A. Sudden weight gain. B. Skin rash or lesions. C. Frequent nosebleeds. D. Decreased appetite. Correct answer: B. Skin rash or lesions. Rationale: biologic agents, while effective in managing RA, can increase the risk of serious infections and have been associated with skin reactions, including rashes or lesions that could indicate a serious adverse reaction or an opportunistic infection. Patients should be instructed to report any skin changes immediately. The other options, such as sudden weight gain, frequent nosebleeds, and decreased appetite, can be side effects of various medications but are not specifically associated with the serious side effects of biologic agents for RA. Question 24. During a community health fair, a nurse is asked about dietary recommendations for managing rheumatoid arthritis. Which of the following advice is most accurate? A. Eliminate all dairy products as they can increase inflammation. B. Incorporate fatty fish, like salmon and mackerel, which are high in omega-3 fatty acids. C. A strict gluten-free diet is essential for all patients with rheumatoid arthritis. D. Limiting water intake can help reduce joint swelling. Correct answer: B. Incorporate fatty fish, like salmon and mackerel, which are high in omega-3 fatty acids. Rationale: dietary omega-3 fatty acids, found in fatty fish such as salmon and mackerel, have anti-inflammatory properties that can help manage inflammation associated with rheumatoid arthritis. There is no evidence that eliminating all dairy products or adhering to a strict gluten-free diet benefits all RA patients, as dietary needs can be individual. Limiting water intake does not reduce joint swelling and can be detrimental to overall health. Question 25. A nurse is discussing exercise recommendations with a patient who has rheumatoid arthritis. Which statement by the patient indicates a need for further teaching? A. Swimming and water aerobics are good options for me. B. I should avoid exercise when my joints are swollen and painful. C. Low-impact activities are best for protecting my joints. D. Stretching exercises can help improve my flexibility and joint function. Correct answer. B. I should avoid exercise when my joints are swollen and painful. Rationale: while it's important to adjust exercise intensity during flare-ups, patients with RA are encouraged to stay as active as their condition allows. Gentle exercises, even during flare-ups, can help maintain joint mobility and reduce stiffness. Completely avoiding exercise can lead to muscle weakness and decreased joint function. Swimming, water aerobics, low-impact activities, and stretching are excellent choices for maintaining fitness while minimizing joint stress. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.